You want your dog to be itch-free and comfortable. You don't want to be woken up every night by their scratching. But these 7 mistakes are the ones that I see all the time in my consult room. Avoid them and you'll be well on the way to beating your dog's allergies for good. Secondary infections. Allergic dogs naturally have a poorer skin quality, and inflammation during an allergy flare, however minor, means that the organisms, the bugs that normally live on the skin, and here I'm talking about bacteria like staph, yeasts like Malassezia, they take advantage of the situation. They have a party, they overgrow, and an infection results. And this infection results in itch. The infection also drives further inflammation. They scratch more, further inflammation. It's a vicious cycle. And so even if you tackle the root cause, say you start anti-allergy medication, but you don't address this infection, the itching will persist until you clear it up. That might involve just topical treatment, it might involve the correct oral treatment, depending on how severe the infection is. But ignore it at your peril, failing to put out the inflammatory fire. There are lots of treatment options for allergies in dogs, but not all of them work quickly, and not all of them are addressed at quickly, rapidly reducing the skin inflammation caused by this disease and getting your dog's comfort levels back to normal. For any allergic dog that is actively itching, that is tearing themselves to pieces, that is waking up at night because they're so uncomfortable, the first step really needs to be to quickly reduce the inflammation and stop their itch. Only once this step is in place should you focus on long-term management strategies, relying on useless testing. Look, the fact is that diagnosing allergies can be challenging. Environmental allergies can only really successfully be diagnosed through a process of elimination, and food allergy diagnosis requires running a food trial. This is time consuming and it can be very challenging to carry out at home. Home testing kits or blood tests, they sound like very attractive options, and they're heavily marketed as the solution, and it would be wonderful if they were, but time and again, critical evaluation of these tests has shown them to be useless with non-allergic dogs, or even just plain water reacting as positive to these tests. So while you might get a positive result, the accuracy of that is highly questionable. Wrong diagnosis. And treating the wrong disease is the next common mistake that I see. Treating for environmental allergies, but failing to control the flea allergy with appropriate prevention, assuming that all chronic skin conditions are allergy-based, and ignoring the autoimmune disease or the mite problem that is actually responsible. Failing to perform a diet trial to rule out a food allergy once and for all. Ultimately, if you don't have the right diagnosis, then how can you treat your dog's problem the most effective way? Relying on single treatments. But then once you have a diagnosis, the next common mistake is actually relying on single treatment modalities. And people often fall into 2 camps with this. The first is avoiding pharmaceuticals at all cost and relying on a single, often unproven supplement, or the other camp being giving drugs and nothing else. And it's not that all allergic dogs need drugs, many don't. It also doesn't mean that these dogs who receive just a monthly Cytopoint or a daily Apoquel are doomed to failure. Many will remain itch-free. But dog allergies are best treated using what we call a multimodal holistic approach. And that's using multiple different treatment strategies at the same time to have the greatest long-term benefit. And when it comes to understanding, individualizing and optimizing the multimodal holistic treatment of a dog with skin allergies, you need to check out the Dog Allergy Summit, where I gathered 18 dog allergy experts to guide you through the practical steps that you can take right now to banish your dog's allergies for good, to rid them of the discomfort, the pain of being constantly itchy, and to really take matters into your own hands. And you can head over to ourpetshealth.com/allergy summit to find out how to control your dog's allergies and eliminate itch for good, not giving treatments time. Some treatments, and specifically drugs for the most part, can be expected to start working within 24 to 48 hours in uncomplicated cases of allergies in dogs. Most other treatment options, though, take time to be integrated into the body, to change the gut microbiome, to improve the skin condition of an allergic dog, basically to have an effect. And for many of these management strategies and treatments, you really need to stick with them for 2 to 3 months or even longer before you can expect to see any kind of improvement in your dog. It's true that there is no one-size-fits-all approach, but too often treatments, they're started and then they're stopped, they're changed or they're modified before they really have a chance to have any kind of effect that we could hope for, stopping when everything is better. And when you do have a good effect, when skin condition has improved, when itch has been banished, I see time and again people just stopping everything that was working and then being very surprised or annoyed or even angry when the itch, when the allergy returns. In effect, we find ourselves right back at the beginning again. If your dog has a good level of control for a reasonable period of time and they seem to be itch-free, then it absolutely can be the right decision to try dialing back treatments. But this needs to be done slowly. It needs to be done one treatment at a time. We need to consider the fact that if it takes time for the treatment to start working, it will take time for the effect of withdrawing that treatment to also be seen. But then, which treatment option should you start your allergic dog on? Well, for the home remedies that I recommend, you need to click on this video. You should also check out that Dog Allergy Summit linked in the description. And until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.